So I did my introductions and my hand sanitizing in our first knee video. So I'm going to bypass that for this one since this is going to be a little longer to begin with anyways. So firstly, I'm going to do capillary fill test just to make sure, just have a baseline for later. All right. Put gauze here, 5 centimeters right in the dorsum. I'm just going to tape down the bottom of that for now. All right. Tape it down. We've got name, date, and time on this one, just in case. All right, and then we are going to do ace wrapping over that. Just to be clear, this is a bit wider than we would normally use on the hand. It would be nicer if it could be a couple centimeters shorter, but we'll make do. Same with the gauze as well, so if a little bit is showing at the end, which it probably will be around the knuckles, it should be a little thinner or a little narrower. All right, a little lower for me, thank you. Just a circular and spiral at the end. Tape that down. We've got name, date, and time. And here is our final wrap. There it is. There's obviously, like I said, a little bit of gauze at the knuckles. There's not much I can do about that though. All right, and just to do another capillary test. Looks normal. How does this feel? Is this too tight? Is it uncomfortable at all?
It feels a tiny bit tight, but it's not up to like painful or anything.
All right. All right, and then, so that's the full bandaging. So then we're gonna do the removal. All right, so tape's gonna come off. Normally I would also have changed my gloves and put hand sanitizer on, but again, for lack of supplies, I have not. But it is important that you would re-hand sanitize before touching this again. All right, then we flipped it over, taking the tape off, and then the proper way to cut this, I'm gonna hold this for me, please. Again, thank you. So the proper way to cut this would normally be for me to cut it this way and then cut it down from his wrist down proximally, but since I don't have the safety scissors like we do have at lab at school, I'm a little hesitant to cut near his wrist with these, but for his sake. But again, I would cut from distal to proximal here, and I would cut distal to proximal here, and then for this case we'll just unwrap it. Now we flip your hand over, and then we would take it up and we would put it in the trash right here, and that would be it. And thus we're keeping everything down instead of lifting any of the blood or anything else that's coming up. So we don't have that interfaces, we're not touching that, it's all down. We put that in the trash and we're all set.